Assalamu alaikum wa rahmatullahi wa barakatuh. With you, Dr. Wasfi Dhahir from Nursing College of Basra University. And today I want to speak in this video about the pharmacology and nursing process. We know that the nursing process, it is systemic, and also it is rational for organization the information. So it is a method to provide safe and effective patient care. So cyclic procedure for nursing process that has 5 basic steps. So now we want to list first the 5 basic steps, and then we explain it one by one. So the first one is assessments and nursing diagnosis, planning and implementation, and finally evaluation. This is a cycle for nursing process. Now we start with the nursing process, and this nursing process we ask questions. How the questions arise? Can we apply nursing process in the drug therapy? Yes, because nursing process is a guide nursing decision about drug administration to ensure the patient safety and meet medical and legal standards. And also it is crucial to achieving the therapeutic objective. And so assessment, which is the first step of the nursing process, this assessment provide a database of baseline information for drug, and this includes subjective and objective. The subjective, that means what patients say, and the objective, it includes the physical examination, laboratory tests, and other diagnostic sources, and as well as data about the drug. So the assessment include the patient as well as the drug. So we start with assessment step, and assessment include initial assessment. That means the assessment pre-administration of a drug, and also we have ongoing assessment. That means we assess during the or after administration. So the initial or pre-administration assessment, this is provide us with information, and so we need to collect a baseline data needed to evaluate therapeutic responses, and also we must collect data needed to evaluate adverse effect, and also to the identification of high-risk patient. That means the contraindication, and also assessment of the patient capacity for self-care, how the patient can care with himself for treatment or for therapy. The objectives of nursing analysis, this is to judgment of appropriateness of the prescribed regimen. Regimen means the system. This judgment is made by considering first the medical diagnosis and action of the prescribed drug, as well as the patient's prior response to drug, and finally the presence of contraindication to the drug. So we should question the drug appropriateness. If the drug has no action that are known to benefit individual with a patient's medical diagnosis, and second, the patients failed to respond to the drug in the past, and third, the patient had a serious adverse reaction to the drug in the past, or the patients have a condition or is using a drug that contraindicated the prescribed drug. If any of these conditions applied, you should consult with the prescriber to determine if the drug should be given or not. Second, identifying potential healthy problem that the drug may cause. And this means to identify potential adverse effect. So the problem may occur due to adverse effect of the therapy. And third, determining the patient's capacity for self-care, as we said previously, how patient can care with himself about taking the drug. So indicate potential independence to self-care. So, as we said before, the first initial pre-administration, now ongoing assessment mean collection of data after administration of a drug and has two basic goals. The first one, collect data related to effectiveness of the drug. And this includes subjective and objective. And second, to monitor for adverse drug reaction. And the second step of nursing pharmacological nursing process is analysis and nursing diagnosis. This is need to determine actual and potential health problem associated with drug therapy. So we must formulate one or more nursing diagnoses that nurses are qualified and licensed to treat. And finally, this is a summary to identify patient problem. Diagnosis to identify patient problem. Now, here we have NANDA. This is a North American Nursing Diagnosis Association, and this information or this rules, this is very important for nursing diagnosis. So what is include NANDA? NANDA include effective therapeutic regimen management and deficient knowledge, as well as non-compliance and anxiety, and finally patient is at risk for injury related to adverse effect of medication. Keep it this in your mind. NANDA. Now the third step after assessment and diagnosis analysis, we have the planning. The planning means written plan. So nurses must develop a written plan directed to find a solution or prevention the problem identified in analysis and diagnosis. And this is plan must be individualized for each patient. So each patient, we must put a plan for nursing process. So, what is the benefit of writing a plan? It is allow you to promote beneficial drug effect and also to modify it as new data are gathered, as well as there is expected outcome, so we must deal with it. So establish expected outcome, that means the goal and objectives. We have four major components of planning. The first one is defining the goals, very important, and setting priorities, and identifying interventions, and finally establishing criteria for evaluation. So that's the next step of the nursing process is evaluation. So now intervention or implementation, after we make assessment and we put a diagnosis and then we put a plan. So if we have any unexpected situation, so we must intervention, or we must find a solution to solve this problem. So what is intervention? Is the natural outgrowth of the assessment and the planning phases of the nursing process. And we have four major components. The first one is drug administration, and the second one is patient education, and the third, intervention to promote therapeutic effect, and finally intervention to minimize adverse effect. This is our goal. From nursing process. If anything occur during any steps of the nursing process, so we must make intervention to solve the problem, if we have. And the fifth step of nursing process is evaluation. It is a systemic, ongoing, and dynamic phase of the nursing process as related to drug therapy. As we say, we speak about the nursing process regarding pharmacology. So evaluation should identify those interventions that should be continued or the step performed to determine the degree to which treatment has succeeded and accomplished. Some outcomes can be evaluated within a few minutes to take a decision of a drug administration. So, evaluation used to evaluate the patient for what? First, effectiveness of drug regimen, the therapeutic response. And second, what we have, if we have adverse drug reaction and interaction. And also, if we have a compliance that adherence to prescribed regimen or patient and family understanding of the drug regimen means system and satisfaction with a treatment. That's all for today, and thank you very much for listening.